live. We are going live. We are going live. I think we are live now. Okay. Hello, everyone. Welcome. Welcome. I am so excited today. We are all here to talk about challenges. Let us continue to address challenges in skilled nursing facilities. And these challenges, as we have mentioned previously, are numerous. We are focusing again more on our staffing issues, on our retention issues, how they affect quality of care and can even lead to abuse of patient of not patients but staff by patients. What are some of the challenges that we are facing in skilled nursing facilities? Are we compliant with the care that we provide? Are we running the skilled nursing facilities as a business? Are we looking towards resident or family satisfaction? What is the quality of care? Are we practicing ethical and legally? Are we thinking about the mental health, not just of the patients, but of the staff as well? What are some of those challenges that we are facing? I want to start with Mr. Welch, introducing Mr. Welch. This is your third time here talking about the same thing, especially how staffing affects the kind of care that we give in skilled nursing facility. Please just give us another introduction of who you are and what you do.
I'm Kenny Welch. I'm the current administrator at Cimarron Park Nursing and Rehab in El Paso, Texas. And I've been doing it for about 25 years. So thanks for having me again.
25 years. Thanks for coming back on board. And I want to go to Kaamilya, who this is your second time here. Welcome again. Thank you for making time to join us here today. Just introduce yourself briefly and tell us what you do.
Yes, hello everyone. I'm Kaamilya Carter Muhammad, and I am an administrator in training. Actually, test next week. Um,
Congratulations.
and I've been in healthcare for 27 years. I started out as an LVN, and worked my way through and learned the ropes by working inside. So I can operate accordingly. So I'm looking forward to this.
You started out as an LVN. I started out as a CNA or
Oh,
in Maryland. I started
wow.
out in Maryland as a CNA. So in Maryland is geriatric nursing assistant. That's how I started out. Then LVN, then
Wow.
RN. So it's been a journey and I am enjoying every bit of it. I am so thankful. And
Awesome.
Mr. Darriel, tell us a little bit about yourself and what you do. Welcome, welcome.
Well, I'm Darriel Jackson, and I have been in the healthcare field, I'll say about 30 years. I started as a CNA, I'm a med aid, and I'm currently working as a certified activity director at a facility in
Congratulations.
Dallas. And
Activities director. Thank you for coming. Activities plays a huge part in the care that we give, especially when in my days when, especially when we were staff challenge, we would try to push everybody towards activity.
yeah, hmm
Is this still happening?
yeah,
Get all the patients into activities. That way we can try and do other pertinent issues. So thank you for what you do.
Mhm.
It's Dana. Please tell us
Hey,
about yourself, what you do, and welcome.
thank you. I have been an LPN for 14 years. So my time in the healthcare, according, in comparison to my age, is not what most people. I was late to the game, but ready for it, ready for the challenge of being in the healthcare.
Thank you. It's not an, and you're an ADON, right?
I am. I've been an assistant director of nurses for about 13 and a half years.
So that is not an easy position.
No,
No.
not at all.
Been there, not easy. Sometimes you don't even know what is your role.
Right.
Right.
You
It's
don't.
everything.
It's
It's everything.
everything. It's everything, and you are never off. You're not just an assistant director. You're a nurse on the floor. You're a CNA. And you're the one to make magic happen.
Yes. I always joke that this job isn't easy. I just make it look easy.
Thank you for making it look easy. It's not easy. And last but not least, Adriana, welcome. I love your hair, girl. I love your hair.
Thank you.
Yes.
My
Tell
name
us.
is Androna Washington. I've been a licensed social worker for 29 years. I've actually been in the healthcare industry for 31 years. I've been in long term care practically since the beginning of my career in social work. So I'm glad to be here.
Thank you. We are glad to have you. I'll just go straight into it. Mr. Welch, we started this. I'm going to start with you. What long term strategies should skilled nursing facilities implement to address staffing shortages and implement and or improve overall quality of care?
That's always one of my favorite questions. And you can call me Kenny, by the way. Please, Mr. Welch is my dad. It's interesting because it's so much has changed in the last 10 or 15 years, but what's not changed is the lack of resources we have for staffing.
Yeah.
And it's not just pay them more money, but we talked about this before. It's mental health resources to help them through things that happen to them at work. I mean, you talked about your experience where you got hurt and they just said, "Are you ready to go back to work now?" So I think we need to stop throwing them into these positions, paying them a bunch of money, and then being surprised that it doesn't work out well. We have to restructure how we take care of our employees, and mental health has to play an important role in that. I mean, they experience death of residents, they experience abuse from the residents. So why aren't we putting more resources into those areas? And I think that's where we have to look at and to try to make a difference.
Right. And I think many times we are talking about improve overall care, improve overall care. We are not talking about how does adequate staffing, adequate in the sense that not just the number of staff, their well-being as well.
Right.
How does that contribute to improve the overall care that we want? Because sometimes, even when we have the number of even when we are counting the number of staffs that are available on that particular day, are they well? If we have staffs today that have been working 16 hours the past 5 days, what quality of care do we expect them to give today? And when they are in that clock 16 hours, it means that we have not counted their commute time. We have not counted the time with their families. So how much sleep have they got in those days? And what quality of care are we expecting them to give? And how is that affecting their mental health? So thank you, Kenny, for touching that. We have to invest in the staff. I want to touch you a little bit, Kaamilya. Talking about training needs, how can we enhance training programs for new administrators like you to better equip them for the challenges they will face in skilled nursing facilities? The last time I was talking with Kenny, he said he has been making all his AITs work overnight to see how the staffing issue is. He has them go on the floor, right, Kenny?
Yeah, and actually now the next step I'm going to do with the new one, she doesn't know it yet, but she's going to actually spend the night as a patient in the facility to understand what our patients go through, and she's going to have to depend on the staff to take care of her.
Mm-hmm. Mm-hmm.
So
Absolutely.
you, like
Mhm.
getting into that, how will you feel? First of all, how will you feel if the person you're training with makes you stay overnight as a patient?
You know, I would go for it because I'm just that type of person. You know, I want to know it all, be it all. You know what I'm saying? Be in depth in it, and with I have to go back to my background. I think it needs to start with a proper interviewable process for AITs. You know, a lot of people they feel like this is what they want to do. They see themselves as a CEO or a general manager or something of a multi-million-dollar company because that's really what you are. And then they see where they'll have this power of this operation, but you don't really know what it takes and what is detailed in it to run it and do it. That's first and foremost a interview process that's better. Preceptors, we have them here in the state of Texas, which I'm going to focus on because this is where we are, where I'm
Yeah.
at. um, I like the way Texas has it set up, but some of the preceptors that are involved, it's a trust system. So really, are they doing the check offs? Are they doing, because it's very in depth, on what should be done.
Mm-hmm.
And I was grateful to get one that did it by the book, but it's then you have those who will start the preceptors and not finish you because of other issues that they have. So I think it needs to be more regulation on the preceptor themselves. I think it needs to be more check-in systems. Maybe have someone check in on that preceptor from the state to make sure that this stuff is happening. Because I
Right.
know a lot of people who were in my AIT class and they have graduated, they have taken their test, and they're really not prepared. So I think it needs to be something more in depth going into that. And I'm saying it because, it would be more work on if it was me. And I know I'm talking, for others coming, but I
Mm-hmm.
think it needs to be more of a check and balance.
So streamline the interview process and more
Hmm.
training
Hmm.
before even saying I'm ready. You need to know what you are ready to face.
Hmm. And
Right.
actually do it. Actually do it. Like there's a part of it. We have a social worker on here. I'm so happy everyone's here. But the social worker part, there's a social worker part that should be completed with a licensed social worker. Is that really happening? You know what I'm saying? So it's like it's broken down in the state of Texas on how you should do it. But is it really happening?
That's the question. It is there on paper. It is the expectation. Is it happening?
Hmm.
Is it happening? I'm gonna come to you, Dario. I was sure. I'm gonna come to you. The activities director. With your extensive experience, what changes have you seen in the challenges faced
The
by
challenges that I see by being close to the people on the floor and work the floor and this and that, we need the administration and the corporate people to back their staff. The staff do not come to work to be abused, disrespected, or anything. That is the main reason why you really don't have people. Is because you don't know what a person come through to get to go to work, and the only thing they do is they get abused, and that's it's not right. The residents can do and say whatever they want to do, and they could be in the wrong, but that staff member has to watch their nose. They can get slapped, kicked, whatever, and then escorted out the door, and the residents still there doing the same thing. So the staff needs, they need to be supported and not just kicked around and abused and do this or do that. Because that's why you don't have people. It's respect, and your staff is not being respected. That's what it is. It all comes from respect.
Kenny? I think that goes back to our very first session.
It does. I absolutely love this group already. 14 minutes in, and I'm already going. I'm taking this stuff back to work with me already. But it's fantastic to hear these things because I agree. I agree that if we don't take care of our staff, that the situation's never going to change. And it's he's right that the residents are going to keep doing that, and if the administration is not willing to help the staff and take care of them, then it's a revolving door.
So, Daryl, if you have time, it is also on Facebook and it is also on YouTube on our podcast session. And everyone who is just joining us, welcome. We see your comments, we'll address them as we go. Thank you. This is part three of skilled nursing facilities challenges faced. It may be staffing, it may be abuse, it may be their mental health issues. Part one, Darriel, I was telling Kenny how, as a nurse on the floor, a patient has scratched me until I was bleeding. Like, it was not an impulsive thing. You could tell the patient had planned to, just because the patient thought I was late with their medication and I was not late. It is an as needed medication that the patient has to ask for. So as soon as they asked, I went to get it. The patient is like, you should have given me 5 minutes ago. No, ma'am, you have to ask for it. And of course, cuz nigger, blah, 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 and scratched me by the nails, had long nails that could only do podiatry care because of their medical conditions. We could not cut them. So scratched me, and it was intentional, like they were digging in. You could tell bleeding and everything. And yeah, bleeding, whatnot. I had to try. I had to triage to the emergency, take a tetanus shot, even though it was not due, but it was severe, and all those things. To say this, why? Less than 15 minutes after, my supervisor was calling me, like, "Where are you? Come and get your keys." The resident was back out there with other peers, watching TV, laughing, talking, like nothing had happened. No one had approached her, to my knowledge, to say, "Hey, what happened? Let us address this." No. And no one had asked me, "How am I feeling? Are you in pain? What did the triage nurse say? Did the doctor see you? Did you get stitches? What are they doing? How are you feeling?" All my supervisor said was, "Where are you? Come and get your keys." Like nothing happened. So this goes to what you just said. How do you think I will feel at that moment? Like you said, take care of your staff. You want them to show up for work, take care of your staff. At that moment, do you think I have a commitment to go back and take their keys and continue to work like nothing happened
Absolutely not.
when nobody showed any concern like something happened? Whew. All right. Adriana, let me come to you as a social work point of view. How does
Sure.
your social work background influence your approach to patients' care in skilled nursing facilities?
Say that again.
How does your social work background influence your approach to
Oh,
patient care in skilled nursing facilities?
well, in social work, we are for lack of a better word, we tend to be the middleman to try to make everything as smooth as possible. Not that we can, we don't walk on water. But when it comes to patient care, who's laughing?
I
You're
think we
you're a
all
social
are.
Everybody.
When it
worker,
comes
not a
to,
miracle worker,
oh,
right?
okay.
We are
I
all
think
like,
we all are.
you
We
have
don't
to
walk
take
on
care.
water. But one of the things I have found over the years is a strong relationship and understanding of exactly what, in this particular case, what nursing does. I'm a big, huge advocate for nursing. Why? Because of things that happen to you, stuff like that. And I know that nursing goes through a lot because we
Mhm.
all do. But particularly our CNAs and our hands-on people providing the care, they do go through a lot. They go through a lot of prejudices, bias, personality disorders, behaviors. You think of it, you name it, it's here. It's here because these are people and they are flawed, and so are we. And to try to provide the best care for them is a challenge. It is. What I've done in the past, especially with difficult residents, just the other day, Dana and I were at work, and one of the CNAs came into Dana's office and was talking how this resident treated her and all this kind of stuff, and she was just really upset. So my first thought is come in, close the door, and vent about it and let's talk about it. And fortunately, the Dana has a very good rapport with the CNAs all over the building and other departments as well. So she was able to calm her down and things like that. Um, but the staff, they have to be able to vent. They have to. And a lot of times, venting at work is not the place for that to happen, unfortunately. So
Mhm.
it's tough.
So,
I'm a staff advocate.
yeah.
I I advocate
Yes.
for my staff. You know, being a nurse, I advocate for my patients. But
Well,
the
then,
most important
Mm-hmm.
thing I can do is advocate for my staff. I
mhm,
listen,
Mm-hmm.
but then you also have to educate your staff that these people that we care for, they're not mentally stable.
Right.
Dementia, Alzheimer's, encephalopathy, all of these things are beyond their control. And
true.
we have to
Mm-hmm.
recognize that and learn to forgive and move forward with these patients. They can't control it. But we can offer assistance as far as, okay, like today you're not going to work with Miss So and so. Okay, you
Right.
need a
Right.
break from that. You have to recognize that, but also empower them to know that these people can't control it, and you cannot personalize that feeling of being attacked.
May I
True.
put
You have
something in there for a sec? Oh, go ahead. I'll go next.
you have to understand, times have changed a lot. In the facility that I'm 55 years old, and there's a lot of people in my facility that are younger than I am. And so they think a lot different, they do a lot different, and their minds are
True.
there, you know. And
True.
so when they come back to the facility, they, they act a little different. They have to understand that these people are here to help you.
Mhm.
You come and demand that you have to show your respect because it's an age thing. They are youngsters now. They are not, usually when you work in a place, you have a lot of I'm a senior citizen. When I go in there and work, I put myself in that person's spot. I don't want to be mistreated, but I don't want to constantly deal with someone that's going to disrespect me.
Yeah.
It's an age thing. It's not everybody. So you have to kind of like just, go around because in some facilities you got, 20-year-olds, and
When you
so, but
talk about
Mm-hmm.
respect, Daria, do you have? I think I have seen moments where the residents or the patients are like, "It's your job, do it."
mm-hmm.
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 Yeah, it's no respect, it's no please, it's no thank you, and even when we don't expect that, it is your job, do it.
This
So,
facility that I am at now has it has done so it's like your zones. You have it's different areas. It's different people. And everybody can't deal with some people. Even like you know you can't just put some people employees into this zone and the person into that zone because they're different zones. And
right.
the urbanizing is it's so different and people just bumps and it's hard to get
Absolutely.
together. Yeah.
Absolutely. And let's come back to you, Dana. How has your experience, not only aid on wound care and all, shape your approach towards managing chronic wounds in the facility? Especially, I'm asking this question especially because we are dealing with staff, quality care, especially. I was a wound nurse too at one time, and there were some wounds that I could not do without the help of the staff or the nurse on the floor, especially with repositioning, especially
Mm-hmm.
with getting the medication that's needed. Sometimes it's not stored in the wound card. The nurse has to give me, and they are working short. They are in the other angle, and I am getting delayed to process my work because they are work. So how has all this challenged you as you're working with staff?
Well, the staffing shortage, where that it's probably more impossible for a CNA to check and change and reposition a patient every 2 hours. That's when you
We
have
are,
to get the
we
nurse
are
involved.
documenting that, right?
What?
We are documenting that is happening.
Yes, we're documenting that it's happening, but is it happening? And what do we do to overcome that shortage? And you have to empower your nurses. Like at the end of the day, that is your patient, and you are the one responsible for the care that's being provided by the CNA. And I try to empower my nurses to take that leadership role over their units, showers, all of those things. It's
Mm-hmm.
not my job to come in tomorrow and make sure that your CNAs gave all their showers. It's your job to ensure that before your shift is over today. Did they get changed? Did they get repositioned? So you have to put some of that ownership back to the charge nurse.
Mm-hmm.
You are leading your CNAs. And
Mm-hmm.
so if they can't provide the care, then who does that fall on? That falls on you to get out there and help. You have to help. You have to assist.
And have you seen moments where,
I'm
go
sorry,
ahead,
go ahead.
go
Can
ahead.
I say something?
Yes.
I just want to go back to just a little bit before, but I'm more on a level of in the beginning. So on orientation, what are we teaching? What are we saying? What are we letting them know the process is going to be in the facility and then following through? Okay, because I'm listening to all of this and I'm thinking, because I've been there, I've been on the floor, I've been here, I've been there, and I know the internal operation of it. So what I'm about to say is not because I haven't worked it or don't understand, but I do know this. It's about follow up also. You can't expect the unexpected from adult people. Okay,
Mhm.
so when you're in a facility, we know we're taking care of people. Do you really know what that means and entails? It starts from the beginning. What is HR doing? What are we teaching them in orientation? Are they getting the proper training from the beginning to understand what's really going on and what they're going to be facing? And it's about the whole picture, not just a few dots on it. We have to deal with the families. We
Mhm.
have to deal with physicians that are our medical directors, they're nurse practitioners or PAs. We have to deal with pharmacy. We have to deal with all type of DMEs. We have to deal with so many different entities in this operation. So it's like, okay, how do we keep ourselves healthy? Then there's that one component. We overwork a certain level of staff,
Mhm.
okay? Because it's called a PPD or SVT. It's a budget. We got to keep it, okay? It's all this stuff that's going on, and in order to what ultimately stay out of trouble, take care of these residents and their families and our staff and everybody else, and make sure everybody is okay. The one person who gets a lot of that in what I see is the social work nursing, but there's people that get it also that may not be speaking, and that's housekeeping, dietary, it's just a lot.
It
And it
is.
sounds like a lot that I'm saying, but it's a lot when we're in the facility
It
and we're
is.
trying to work it all through. It's a lot. So,
It
what component do we use to help us stay sane and healthy in these environments? And why don't we add another component to help our staff as a benefit to get psychiatric or either psychology or some type of therapist to talk to or help?
That's very true. That's very true. And that's the big picture that we are failing to paint. We are trying to blame, probably staff did not do this, staff did not do this, or this was not done. Or we just come and take, for example, the meal trays. Why are there some meal trays still in the cart? Yeah. And you see the floor, it is 40 people, and it is just two people available to pass out trays. And you think everybody is going to eat warm food? How is that possible? I'll come back to you, Dana. For example, we're supposed to be more people today. One person is not here. You know why? She had three callings this morning and she had to go into work. Let's say those callings are in the same department or the same floor. What do we expect her to do? Especially it's weekend. Sometimes it's difficult to find coverage when you have callings like that. She could not be here. She had to go to work to fill in that spot. Do you think everything will be done? And what would you do? Go to the charge nurse and punish that charge nurse as to why A, B, C was not done?
No, no. You've got
It's
to figure out a way to get more people involved as well.
right.
As in my experience, I've had administrators that have come in and helped. I've had social workers, and Drana's one of them. She's come in and worked in the kitchen,
Yeah,
activities director, passing trays, helping do all of those things that are non-clinical, but they're essential, right?
right,
I mean, if you could give the non-clinical part of it some support, then clinical can do what they need to do for that
right.
patient.
Like, can you, Dana, let me stay with you. Can you share an example of a time where you had to manage a significant crisis and what lesson learned from that, especially being on the floor?
Um,
You got
God,
it.
there's so many.
Darriel say you got it.
What do you want to say, Darriel? Help me
No,
out
you,
here.
you got it. I don't work with you. Got it. You got it.
I have worked 15-hour shifts before and was driving home when the on-call phone went off that, hey, we only have 2 aides in the building. And so what do you do at that moment? You turn around, you go back. I'm working as a CNA on the floor. I've had no sleep. I've been up for over 24 hours. But what happens with that is that you lead by example, right? People respect that and
Yeah,
people want to help you.
yeah.
The next time I call and say, I need some help, someone says, hey, I'm going to come do that for you.
Right.
Darriel has been one of those people.
Hmm.
When you put yourself in their shoes and you say, there's no job that is, too small for me, right? Or too large for me. I'm going to come and I'm going to do it. And so when you earn the respect of your peers and your subordinates, that makes a huge difference.
Right. Especially when you show them that we are all in this together. I'm not bigger than
Exactly.
you. We can do
Exactly.
this together. I'll share one crisis. I think I told Kenny before where one staff had an issue. It was all, either the work report her for abandonment, for patient abandonment, or the daycare called CPS on her kids, because it's not been the first time that she's being mandated to stay over and daycare is closing late because there's no one else to pick her kids. Not only that, whatever she's staying over and making on overtime is not even enough to pay the daycare for staying after hours to keep her kids. Now, it's not just staying after hours to keep her kids. Do they want to stay after hours to keep her kids? Do they have their own responsibilities to go back home too? Those are the critical moments that we want to define. How are we fixing this when we need to mandate staff, forgetting that they have other lives, other essential lives going on? And it is just not one person problem. It didn't start today. Mr. Welch, Kenny, how can facilities balance all this? Is it cost efficient that we are looking for, or is it the high standards of patient care and staff well-being that we are looking for? Or how are we trying to balance all this?
Well, I think with the conversation that's going on, it has to start with the top. Okay, if I, as an administrator, am not creating an environment that my people want to come to work for, they're not going to come to work, and it's not going to matter how much money I pay them. So it has to start there. But also, we focus so much on what this CNA didn't do, what this nurse didn't do. Do you ever sit back and go, okay, as a leadership team, the CNA wasn't able to do this. Why not? What could we do differently
Mhm.
as a group to change to where that CNA doesn't feel like they're not able to get their work done? If they're not able to get their work done, what can we do to help them get their work done?
Mhm.
I realize staffing shortage plays a huge role in what we do. But again, it goes back to the environment we create. And if we're not taking care of our staff, or we're not making sure they have the resources necessary to do their job, they're not going to want to stay. So we have to make those changes, and we have to make those changes in everything we do. And I agree. I've worked as a CNA housekeeper. One time we had the entire kitchen staff walk out. The managers and I went in and made food. That's what we did. I mean, that's what you do.
Exactly.
So I think that as leaders in this industry, and I nursing, is fantastic. I cannot emphasize enough how important activities play a role in our residents. As social workers, there's no way in the world I want to be a social worker. I'm telling you that right now. You guys are busier than I am, and I run the building, so no thanks. But my hats off to you guys, because that's a fantastic job that you do. But it really takes everybody to jump in and help out and pitch in when those things occur. And she's right. Lead by example.
Yeah.
I would like to say something as far
Yes.
as before I ever would reprimand an employee, a CNA, or a nurse, the first question I ask is, what challenges are you facing that is preventing you from carrying out these tasks?
Yes. Yes.
Because let
Absolutely.
me try to
Yes.
resolve the challenges. And
Mm-hmm.
one time it was that I ended up having to change the assignment. Like we used to have 2 and 300 haul together for a nurse, but we moved it to one in 300. We switched that up because you have to look at how many diabetics are there, how many G tubes, and how can we make this more manageable for this
Right.
nurse to get everything done. Same with the CNAs. Sometimes you have to look at acuity based
Yeah.
versus numbers. It
Numbers.
can't just be, oh, you can handle 13 patients.
Yeah.
How many Hoyers? How many incontinence? You have to look at the challenges that they face before we, try to correct them or tell them they're not doing their job.
Yeah. Thank you for that interjection, because you don't just want to reprimand because, oh, they failed to do something. Was it something that they are capable of doing? Was it
Right,
something that you can do? If you were in that same shoe, would you have been able to accomplish that task? So acknowledging the challenges, identifying the challenges, and fixing them. It's true that sometimes it can be a repetitive thing for an individual not to complete the task. Then that is different. But when we see that they are not able to perform this, it's not like they are sitting behind the decks. Some of
right,
them haven't, they go 8 hours without taking a break. We know of cases where staff they clock out as if they are taking a break, but they are not taking a break. They are still on the floor, and we know that. So
right.
thank you that you try to identify the challenges, fix it before even thinking of reprimanding anybody. And Adriana, on your social work role, or on that role that you play, how do you facilitate that? Being an advocate, how do you facilitate the collaboration between social workers, healthcare professionals, to ensure that the residents are being taken care of?
Well, not only do you have to like coordinate with all the other departments that you have to work with, some things are really easy to fix for the residents and some things are not. But one of the things that, as I know all of us know, is making rounds, and it takes the whole village to advocate for the resident, not just the social worker. Because there
Mm-hmm.
are CNAs that advocate uh, for the residents, the nurses, dietary, housekeeping, everybody that comes into contact has an opportunity to advocate for that patient. So luckily, it's been my experience that the advocacy part from different departments other than just me and also the administrator, um, it makes things a lot better for the residents. There are some residents, I was reading these questions. Um, some of the residents have limited family support. So that means, guess what? The staff at the facility ends up being their support.
Yeah.
So, and not just the holidays and the special occasions, just any time. Communication is a beautiful thing. Do y'all remember back in the day when it was a sin to have your cell phone to communicate with somebody about something that somebody needs or this and that or
Yes.
whatever. Y'all remember
Yes.
those days?
Mm-hmm.
Leave your phone, leave your phone on your desk. So therefore you're running around looking for this person, that person, this person, that person. The best thing that ever came out was this group me thing. I
Oh my
love
God,
it.
I love it. I love it.
I
Instantaneous.
love it.
I need help.
Yes, yes. And I consider that part as advocating. Of course it is, because we're communicating about who needs what needs to be done,
Mm-hmm.
yada, yada, yada. But do y'all remember those days?
Yep.
I actually got
I
written
remember
up
when I
for
was
using
working,
my cell phone.
they wouldn't even let us get into the facility with our cell phone. They would tell us leave it in the car. And our excuse was,
Yeah,
what if we have a family emergency? They said, well, if it is a family or your child's school or they can give them your work number.
Right.
yeah,
Phone in the car. It was
But is
crazy.
somebody going to answer the phone?
Right.
right.
Exactly.
The surveyors would write deficiencies
Yeah.
if they would see you in the hallway with the phone.
Mhm.
Right.
And now they
Yeah,
use them to take pictures of everything.
Right.
yeah.
Yeah.
Very true.
But look, we digress. That was just we're on advocacy, right? It takes everybody to advocate for the
It
resident,
takes
not just
everybody
the
to
social worker.
advocate.
It takes
Yes,
everybody.
It takes everybody to advocate. The problems that sometimes, as a floor nurse, I would have or I had is when the social worker come and say, this patient said blah blah blah, and you guys are just telling us what to do without even asking us if it happened or not. It sometimes nursing feel like social work is just taking resident side and does not care about nurses. What do you think about that?
I'm not that girl.
No, she is
I'm
not
not
that
that
girl.
girl. I'm not. I'm not. I'm well aware that residents can be manipulative, and again, you have dementia. They're not always there, and sometimes they're all there, like they're scoring perfect on their bends and slums and all that. But they have personalities. They're people,
Mhm.
so you can't always take one side over the other. You
Right.
can't always do that. Times you can, but you can't do that all the time because it's not real. It's not true.
Yeah. I want to go to that.
So
We
yeah.
for those joining
So
us, we're still talking about challenges of skilled nursing facilities and how well can we make our staff to make the patients well. I think at one point we have all agreed that if staff is not well, they will not give that care that will make the patients whole again. They will not give that holistic care. It will not be possible if staff is not well rounded. If staff doesn't feel supported, they will not be able to give that quality care that they need to give. So let us invest towards our staff. Let us invest in them. Make sure that we are giving them the resources, the support that they need. Care very well for this for the residents. Now let me come to you, Darriel, because we count on you on that floor to engage the resident, especially when we are running around making beds, doing this, doing that, documentation. We are counting, especially when we have all those high fall risk patients. We are counting on you to keep them engaged. How do you create meaningful activities that does not only engage the residents but also contribute to their overall mental and emotional being?
Each individual is done differently. Mostly try to do groups, get them into group things and find out what mostly they want to do, not what I want to do. I
Mhm.
don't believe in forcing them and doing things. If I have to get everybody to do something individual for them to get it done to make them feel better, that's what it is. I have a lot of them coming to me. It's sometimes I feel like my job is a babysitting job. you know. because they come in when they find out that they're comfortable and they can talk and tell you everything. And what I do when they come to me, I'm sending them to you. Social, I mean,
Send them
I'm
on.
sending them straight to you. But
If
I
they need
have
counseling, we can set that up.
right. I don't when we do I do movies and stuff like that, and we don't do old movies. We do the new movies that's out. Everything is pretty much keeping them up to date. And this and that. You know.
Mhm.
But yeah, it's a task. I have a few blind people. You have, and then I have people that don't speak English, and I don't speak English, so I have to get stuff, for them, to communicate, and all the stuff for them to do. So, yeah.
Right. Most of the time, we count on the activities director to help make it a home for them.
And it's a lot of times the staff doesn't just want to take the residents to activities. A lot of if they take them to activities, they don't have to worry about them. But they prefer to just pop them off over there, and then me myself, like now, I don't have an assistant. I have to run and get them. But all the staff has to do is get the residents to activities, and that's like they have for at least 2 or 3 hours, and they have free time. But they don't understand that part. You know, the residents are telling them to get me up to bring me here.
Mhm.
But you know,
Right. And to talk about that, I have been on the floor where was it that staff did not want to take them or they were just tired or they
mm-hmm.
just had yeah. So on the floor, let's say a staff have 13 patients. I'll go with the number Dana gave earlier. Let's say a staff has 13 patients and five of them wants to go to activity and they are all Hoyer lifts or something. By the time you cannot do a Hoyer by yourself, by the time you're waiting for someone to come help you do that Hoyer lift, either the time has passed, you may succeed in getting two, and maybe you're just thinking like, oh, I have to put them back in bed before next shift comes, or I have to put them back, and that will drag. They will not be ready. I will not have anybody to help. We'll be doing last rounds because we are working short. Staff do understand that when they put them in activity, and sometimes, especially if you're alone in activity, you need also that backup to just help watch them and help navigate you through the process while you're doing the activities and they are watching. Go ahead, Daria.
Yeah, see, in activity, we are kind of double certified. We are CNAs also. Most of us are. So
Right.
if a CNA needs something to get them there, all they need is someone to spot them, and we're there to help them. To get them there. So it really wasn't take that much time. Just a lot of time they use it as an excuse. But they can get them up and get them down there
That's good.
because the more they get them up, so just coloring is an exercise for them. It's a
It
movement.
is.
It gets them going.
It
Gets them
is.
frustrated. Yeah.
Right. And we continue to count on you guys to create that home setting for them. Let them don't feel like they are in an alien place, or let them don't lost some of their skills or joys or things that they used to do because they are in this facility now. They feel like they are caged up. So thank you for that. And staff, listen, if you need time to make the beds or to help do some other things that you were not able to do the other day, get them into activity so that activity can help you watch them while you complete the other tasks that you need to do. I want to go to Kaamilya a little bit. As a as an administrator in training, what are you seeing? What are some of the key indicators you focus on to ensure that quality care is maintained, especially in high stress environment? And yes, we work in a nursing is a very high stress environment. I don't think anybody can ever pay a nurse for all the stress that they go through.
Well, I want to first start out by kind of piggybacking on Kenny. When you build that environment, first you need to get up and be seen, to know that you, so staff knows that you care. To me, An administrator's job is not a desk job. It's not a job where you bark orders. Sometimes you need to receive them.
Mm-hmm.
I'm a firm believer in getting knowledge from the area and having a team and or building a team that is an expert in that area, and then we all come together. And majority of the time I'm leading the operation where they're telling me what's going on because they're managers of that department. What I really have focused on and seen, and I'm gonna talk about activities, is activities really is a underdog job. And I say that by saying this. An activity director can do meals, they can do they can do a lot of things. They have to know diets, they have to know what's going on. They are a hidden jewel that a lot of facilities do not use properly. I'm just gonna say that. It's
Yeah.
just something, you know what I'm saying? Like it's
Mhm.
some things that are out there that nursing, yes, is hard. I've been one for
I think
27
Daria is
years.
agreeing to that.
Yeah, I mean,
No,
it just
we are
it.
actually we are activity directors personnel are overworked, overused. We don't have enough help. Like I want to tell my administrator the other day and did she said, I want you doing this and doing that. I'm like, well, when is break time? When is paperwork time?
Uh-huh.
Because they done took my access away from home. So I have to do everything there.
Hmm.
So you have to have time, you know what I'm saying? And
You
it
Well,
takes
do.
I'm glad they took your access from home. When you're at home, stay home.
well,
Right,
I do. I have free time, but I could do my work
right.
at home because I don't sit down at work. It's hard for
Hmm.
me to sit down. I'm
Oh,
constantly,
absolutely.
yeah, I'm constantly busy.
And the model of it, but the model of a facility, it's I've seen and I've become an administrator for this purpose, for advocacy, to try to make differences. I know we are in a world that we're in now, but I do want to make some differences because of the model of a facility.
Mm-hmm.
It's when you look at the organizational structure and the model of it, you're gonna all be overworked because of the budgeting. It's gonna take some advocacy. It's gonna take us
Yep.
trying to get some things going in that direction. We need to be doing more lobbying. We need to be doing more things to put attention to us because
Lobbying, I love
we
that.
are the most overregulated but under you budgeted. You get what I'm saying? Like they don't
Mhm.
want to give us money, but they want to regulate us on every little thing that we do, and that causes a stressful environment. It
Mhm.
causes people to be overworked. With your budgets, it causes
It,
things like that to happen. Our budgeting from the top, you would be amazed if everyone could see the budget. I would love to be the type of administrator where I could let everyone see the budget and try to help to see how we can fix things and make things better instead of me just seeing it and trying to fix it.
Daria, you
that
wanted
that
to
that
say
has a
something?
lot to do with it.
Right.
Speaking of y'all too, as administrators, y'all,
Right.
y'all activities budgets don't be that much, but y'all require a whole lot out of that budget.
Mhm.
And sometimes you don't get volunteers and do that. So activities spends a lot of money in activities out of their own pockets. But but the administrators they say I want this done and that. But when it comes to that budget thing, it has to be in that. Just imagine doing activities at $150 or $200 a month.
And he's so correct because then now we're back to that.
Mhm.
Now we're back to that process of okay, where's the staff or who wants to work here? I mean, we're
Mhm.
talking about staffing shortages and we're talking about things like that. He made a valid point. It's like, why would you want to either you be so excited and then why would you want to stay in this environment? It just trickles through each department. And then
Mhm.
we wonder why we have shortages.
Yeah.
Kenny, what do you think about that? You're working out the activities director, he's burnt out just because you know that he is a CNA. He can do XYZ. Let's say you're short CNA today, you pull your activities director that hour. So that's 8 hours, no activities. You pull him to the floor. Then the days that you are not short or something is happening, you call him, please help us pass out trays. Please do this. He has his own job role. Let's say surveyors come and they are doing the annual survey or something, and something is missing in activities. I know that his excuse will not be, oh, most of the time I am passing out trays. Most of the time I work as a CNA. Most of the time I work as this. I don't think you would take that as an excuse. How do we fix this, Kenny?
Well, a couple things. Number one, he said something very important a little while ago. You know, there's no call lights in the activities room. So if you get the residents in the activities room, they're not ringing the call lights. I mean, I'm with him 100%. I won't tell him what my activity director's budget is because he'll drive to El Paso and start working with me. But the other mindset we've got to change is we've got to start making our
What's
managers
the
feel like
budget?
it's about $1,000 a month.
How much?
Oh wow.
$1,000 a month.
Where you at?
And who do you, look, Kenny? Who do you work for?
Right. I'll put in my trash for tomorrow.
That's about the most generous budget for activities I've ever seen in my career.
Yeah.
Wow.
And that's
But
because, Kenny, that's because I know you're fighting for every department in your facility.
we have to change the mindset that our managers feel like they have to work at home. When you go home,
Mm-hmm.
They own.
that
Mm-hmm.
that
Yeah.
you should be so excited to go home because you're leaving work at work. And I tell them all the time, stop working from home
Hard.
because
That's hard to do, right, Dana?
Oh my God.
Oh, don't
I
ask
mean,
Dana.
Right.
even if
That's
I
hard.
don't
Yeah,
have the
that's hard
As
to
an
on-call
do.
agent.
phone,
So
you
I
have
have
your phone. It never stops.
Dana, let me tell you, Dana, I have worked where when you are hourly, they take away your access to work from home. When
Mm-hmm.
you're salary, they give you access. I
And,
have.
and
Bingo.
that's what this new company did. They took our salary away and made us hourly, which they done a good thing because you make more money hourly.
Mm-hmm. Mm-hmm. When
as
you're
an admin-
salary,
as an administrator, I'm expected to work from home. Okay, it's my building, but I don't expect my managers to work from home. I want them to go home when they're on vacation. I don't call them. If the surveyors walk in, we'll figure it out.
That's how our new people are. That's how they are.
We have to. Time off is so. Time off should be valued just like any other benefit. Probably more so because that's the stress relief that we can't give them at work.
Yeah.
yeah.
So, and I tell them
Absolutely.
don't call me when I'm on vacation, but they call me anyway, and that's fine. I don't care. But I don't want my managers bothered while they're on vacation. And certainly when they go home at night, they should be able to go home and enjoy their families or whatever it is they do, and not have to worry about work.
Mm-hmm.
Mm, mm.
Absolutely. I mean, time off is so essential.
Mm-hmm.
One of the things that I learned after COVID, because in COVID, nobody got time off. It was you're working 65 hours of overtime in a 2 week period. But now that things have settled down, time off is very important to me. I plan a trip once a month. I'm only taking a Thursday and a Friday with a weekend, but that time for me to disconnect from all of this madness is so very important, and it's really helped my overall well-being and mental health.
And yes, and you know what? I'm throwing this
That's
out there
self
too.
care, Dana.
That
Mhm.
I'm gonna tell you this. I want to know because the company I'm currently with, they have a program, and I love them for it. It's a wellness. It's like a live well program
Mm-hmm.
where they can you still accrue time, but your general manager, or administrator can give you time off without penalization. Get what I'm saying,
Yeah.
without penalizing you,
Right.
because
Mm-hmm.
you do have to have that mental process going. We have to face the fact, y'all, that we deal with mental health daily in long-term
Mhm.
care.
Amen.
Mm-hmm.
Period.
Mm-hmm.
And
That's
so,
what
and
we
we
do.
have to stay healthy because you think about when you come home, you still have to deal with your budget at home, your life, your everything, and then you got to click it back on to the residents, and it affects us all. If
Oh,
someone falls in a
Absolutely.
facility, it affects us all. If someone passes away, it affects us all.
mhm.
If you know what I'm saying, and
Yes,
it's like we all need that peace.
yes. I
Yeah,
think Dana is trying to
exactly.
come back. I think her network is disturbing. But I want to ask you this, Dana. As a leader, you thank God you have found time to stay grounded once a month, Thursday, Friday, Saturday, Sunday. You have that as an outlet where you, how do you support your staff, your subordinates, to care for their mental health as well?
I mean, I encourage them. We all have the hard workers that want to pick up doubles and doubles and doubles because they have families to feed, but they don't think about the cost that it comes to them and their well being. So,
Yes,
as a manager, you have to learn to say, I appreciate you wanting to help, but I'm not going to let you do
Yeah,
this today. You have to help them realize that their time off is just as important to their mental health as it is to your own.
yes,
So
yes. Daria,
you
what
have
Employee
would
to
what would
sometimes
retention.
you have to
I was just
help
going
them
to
find the
get
balance.
with her because we worked a lot. But when she speak about them wanting to work doubles, it's certain place you have certain people, and you have good people that like to work doubles because they like to spend a little money, and
Hmm.
so they will do it, and they do pretty good work. And then you have the ones that they get burnt out. You do have some that always volunteer, but sometimes I'm one. But
mhm.
yeah, it happens.
You've helped a lot.
Yeah.
I want to know this. This question is for Kenny. I have a question.
Yes,
So, employee retention, because we're talking about shortages and things like that. How, what program do you have, or how do you do employee retention? Because that has a lot to do with shortage. I mean, we get them in the door, 2 weeks later, they're gone. So we're talking about shortage. So, what about that retention to retain what we have so we don't have that?
I think you've already answered your own question in the way that you said you have to leave your desk. I mean, there's no way you can run a building from your desk, and you have to go out and talk to your employees. And that getting to know your employees um, makes a huge difference because they know that you care about them. They know you care about their families. Now that doesn't solve it all because we still have people that show up first day orientation and they run away screaming. But um, just getting out there and getting to know them. The one thing I tell my managers, and I also tell them to tell their employees, your family is more important than this job. If you have an emergency, I want you to go home, take care of it, and then come back because you're not going to work 100% if you're worried about somebody at home. And you're definitely not going to provide good care because you're worried about somebody at home. So it's all about building those relationships. Are kind of how I've helped with some retention. Money's not the answer. It's not. And I will tell you, speaking of mental health, I meant to say this earlier. These podcasts that we've been having, the third one, is mental health wellness for me because I get to talk about some of these issues with other people. So,
mhm.
Mercy, thank you because this has been fantastic for my
Yeah.
mental health as well. But just getting to know them, and you said it where you said, get up from your desk and go make rounds. I mean, the consultants say when they come to my building, we can never find him. Well, that's a good thing.
Exactly.
Yeah,
Exactly.
yeah. I have worked where, especially just growing up in nursing, I never knew that an administrator can even come out. You know how you work in facilities that are locked down and stuff, where once you pass this door, you know you're going into the clinical session. I've worked places where I never knew that an administrator is even allowed to cross those doors because he is always in his office after morning meetings with staff, with the leaders. That's all you see. He's always in his office. And I know that one time somebody had called him to come, and it was a fall, either a death or a fall. Somebody had called him to come in and see he's like, oh, I'm not in nursing. And I did not understand until later. You're not in nursing? I thought your title is a nursing administrator.
Mhm.
So what does that mean, you're not in nursing? When we separate as a leader, when we separate and pick and choose what we can do, staff sees those things. They know. That's why staff will come in. It's not only about a rapport. Staff will come in versus if this person called them or if another person called them. It matters who called them to come fill in a shift. They will not do it for somebody. They'll be like, oh, figure it out. But they will do it for another person because that person really wants their well-being. Kenny, I've seen you on Facebook, you're posting this, you're sharing this. We appreciate that. We thank you so much. And I have seen some responses from your staff. They love you. It is nothing to hide. They said you're the best manager ever. It's
Aw, that's so
yeah,
sweet.
I read it there.
Congratulations.
It's
That's
nothing to
wonderful.
Thank you.
hide. When you truly care and compassionate and passionate about what you're doing, it shows. It doesn't. If you are just coming here and show concern and go back and not show concern towards your staff, they will know. But I think you're able to speak it here freely because that's what you do every day in, day out. And somebody, Rebecca, thank you. We appreciate all your comments. We are just here many today. We are not acknowledging those who are watching. But she said, I am curious to hear about the latest innovations in patient care. I am curious to know how, let me rephrase that, how staffing is affecting the things that we can do in patient care. Kenny, last time we talked about McDonald's even paying more than what some CNAs make.
Mm-hmm.
Right, Darriel? Are
Yes,
you aware of that?
yes, ma'am.
Yep.
So why would I not go and work there and eat free food even that and be less stressed and maybe even get some tips from customers than
Mhm.
come to nursing where it feels like the moment you walk through that door, there's an emotional drain that just fills you. Not only we are talking about patients not even acknowledging us, not even being grateful for the care we give them. Are we even having the support? When you walk in, does Mr. Kenny even say, oh, hi, Mercy, thank you for coming in today? Or it's just that you're on the clock, you're getting paid? Do you even feel like someone appreciated you? Yes, it is a job, you're getting paid. But do you feel like someone said, hey, welcome, thank you for coming in? Let's stop all the donuts, let's stop all the candy, let's stop all the I don't know what we usually
No
buy.
more pizza.
No.
You know, I actually stopped doing pizza a while back because it is so insulting to the staff at
It
this
is.
point. You did a good job. Here's some pizza. And I've said this since college, if you take care of the staff, they will take care of your residents. That's
Yes,
it. That's as simple as it is.
yes,
Very true.
I
yes.
agree.
And you can tell who is working from their heart.
Right.
Mhm.
Oh,
Don't
100%.
burn them out because you can tell 2020, you can be like, this is a good staff. They work from their heart. 2023, they are still a good staff. They work. By 2024, you start seeing like, it's just care. What
Mhm.
happens to them? What
Mhm.
happened? We burned them out. We did not appreciate them. We think that because they are getting that payroll or whatever, somebody even say, oh, they are on overtime, they are making money. Do you really think somebody will stay over on overtime because of the money every so often, or is because they really care about the staff? I have seen staff who take genuine care of patients like they would their own parents. That was never because of money.
Mhm.
I have
Mhm.
It's
seen
because of
staff
need.
yeah, I've seen staff giving showers to those that it was not even their shower days. And it's not like, and they still work short and they still gave showers to some people. It
Mm-hmm.
wasn't even their shower. That is care.
Mhm.
I have seen
Mhm.
staff sit down, rub residents' feet, talk to them. No matter how high pressure they were, they walked into a room smiling.
Mhm.
That is not for money.
It's not. It's not for money. It's not. And you know the thing of it is, you brought something up about them making more money even at Bucky's. We have Bucky's here, in Texas. It's a gas station. and it's a luxurious gas station. I'm a fan. I'm not. I love them, but they
Yeah,
do
me
that.
too.
I love them, but they pay.
Everybody love Bucky's.
Everybody love buckets, right? But
Bucky Nuggets.
that they pay,
Mhm.
and they're when you look at their benefits package and what they offer and things like that. And when I and as an AIT, I look at stuff like that now. I look at things a lot different. So I'm always looking at other companies and what they're doing and stuff like that. And when I see who they are, how they manage, and what they do, it's like their staff, it's like Chick-fil-A, all these different places where these people they like to work there and they want to be there. And yes, you want a money and compensation, but think about what they're doing. Their mindset is not like ours has to be. And so when you think about someone working at Bucky's and then you go into a facility, those people are stressed sometimes coming into that, getting in their car, and knowing where they're going.
Yeah.
Bucky's, you're gonna see different people laugh it off. You can go
Hmm.
here, go there. But when you go into a facility, it's so different. The mindset is still there. We still have to go back to how we retain mental, health and wealth. Um, that's the worst place to go is the facility because we eat bad. We need to promote better eating habits, better all of that because how many times as nurses do we eat out or we grab or we don't eat at all.
Yeah.
And
How
that's
many
just
times the nurses hold their pee?
right. Our
12
bladders are bad, and then it's shortage across the board. I know we talk about nursing a lot, but shortages is across the board. Housekeepers needing people to clean the facilities. You know what I'm saying? Because they're one of the departments that when your census is low, they're cut. So that's what has a lot to do with shortage too with staff because when you're budgeting and you have a census hole, and once you get to a certain census and you don't get it up, then you have to cut your staff. Well, then they leave. But then when your census goes back up, then
You don't have anybody.
you don't have anybody. So it still goes back. It's to that sometimes double-edged sword, and then you have to change and then modify. So it's like, what do we do with that? It's a lot of different questions.
Yeah, it is. To round up, Camila, give us one last thought about how can staff, it can be any staff, not just nursing staff, take care of their mental health working in high tension places like this.
hmm Well, first you have to have, in my opinion, now this is my opinion, you have to have a source of contentment and power, whether it's God or meditation or whatnot. You have to have a place that you can go where you can have a peace within yourself. Okay. Then on top of that, you have to take the time out and stop. You have to take time off and have vacation or just not do anything because
Yeah.
if you take the time off and you're still working from home, that's not a mental break. Even though you change the environment, your mentality is still there. So
Hmm.
you could be at home working in a facility, working at the gas station, working in your car, working in your hotel, in the Virgin Islands working, but if you have not removed yourself mentally and not touched it, then you still haven't removed yourself so you can have that mental break. Okay. Then I feel like you should have someone to talk to.
Yeah.
We have so many different vendors and different people that we pay for and get. Why can't, as a company, you add to that budget, take some from someone at the top that's making this amount of money and care about your staff down here that's allowing you to make that amount of money?
Wonderful.
Okay,
Yes.
and give the resources needed
To them.
for mental health
Hmm.
and for us to be okay and raise the bar as far as budgeting and pay.
Yes. Yes.
Absolutely.
Yes. Yes. Oh my God, I'm so glad you said that. Why don't we reflect our budget? Maybe not even taking from somewhere, but why don't we lobby more, increase that budget,
Mhm,
and take care of those who are helping us make that money? The
mhm,
truth is, if there are no nursing staff, there is no facility. That is
mhm,
the truth.
mhm.
If
True.
there are no nursing staff, there is no facility.
Mm-hmm.
Why don't we make a budget that is reflective
Mm-hmm.
of appreciation for them,
Yeah.
so that we can also try, like you said, bring someone in, not someone that they call from corporate one or two times for 5 minutes and say, oh, they are talking to somebody about their mental health. We know that is not feasible. Bring someone in that they can confidentially talk to and make sure that some of those tensions are released. Then, to round up, how would you advise your staff? What would you advocate for to see that staff mental health is being cared for?
I think you're onto something with having somebody come in. I mean, long-term care facilities have psych services that come in and talk with our residents. I mean, our staff would benefit from that same thing.
Yes,
I mean,
yes, yes.
you recognize somebody that's having challenges, somebody that's got some personal or financial problems going on,
Mhm.
and you get them somebody to talk to.
Yeah,
We should provide that.
yeah. You
I
And
have
know I benefited from that.
and
I
physical
began,
therapy.
right.
and
I
physical.
Okay.
began,
Yes,
Physical therapy.
yeah,
yes.
Exactly.
I
Yes.
began my nursing career in an inpatient psychiatric hospital, and I had a patient that tried to hang himself. And it devastated me that, I was responsible for watching this young man. I knew he was on suicide watch, but in a second, this happened.
Yeah.
And I was able to get him off of,
Mm-hmm.
the door. But I went to counseling that was provided to me by the facility for probably about a month. Once a week, when I was at work, I went and saw the counselor and we talked through all of these
Wonderful.
things. And it benefited me so
Wonderful.
much because, everything in me, I was a brand new nurse and I'm like, oh my God, I'm such a failure. I failed this patient. So I believe that mental health awareness and support is very important in what we do every day.
Mm-hmm.
You're
Amen.
making me emotional now.
Amen.
As a brand new nurse, Dana, it was a long-term care facility. This was 2008, I believe. It was a long-term care facility, brand new, weekend, where most leadership are out. And 2008, the staff issue was not like it's now.
Right.
So, but it was weekend. Most leadership is out. I had a patient, full code, dying. The family had not changed the status. The family did not want her transferred. They had started the DNR process on Friday, left without completing it. And even when you read the note, it's showing like maybe this patient will not survive over the weekend. Now, brand newness, I have that patient on my assignment. And of course, I am one way doing wounds, doing finger sticks, and they are calling me another way. And I was pregnant. They're calling me. I was running like, oh Jesus. The patient had coded my very first day on the floor.
Oh my
And
goodness.
what Camila said about training, I had my training, but not on that floor. So that day I came, so I did not know the resident. That day I came, it's a Saturday. There was a calling on that floor. Every nurse in the unit maintained their positions, and me, brand new, threw me to the assignment that somebody had called in. In less than 3 hours of my day, I have a dying patient. The patient coded, of course, brand new. I'm trying to put all the skills I have, and weekend, the patient died. Had to call whatever happened, sent her out, but the patient died in the facility. By the time 911 came, there was no pulse and all that. The patient was already frail. The DNR should have been done before they left on Friday, but this is it. But now you said something. You had counseling. This is me pregnant, first day on the floor. The whole weekend, how do you think I spent that whole weekend? And I was off on Monday. I was doing weekend stuff. I was off on Monday. How do you think I spent? I am not only emotional that I lost a patient, I am rethinking the scene every second. Did I do something wrong? Is there something else I should have done? Is there something else I should have done? To the point that I started questioning, maybe this nursing is not for me. Zero help. But I was so happy that on Tuesday, the director of nursing called me and I was scared, like, oh, are they going to say I did something wrong? Are they? I picked up the phone. I'm glad the first thing she said was the paramedic left a wonderful review for you and for you guys. We are so proud of you. We watched the videos. You guys did everything you were supposed to do. Are you okay? That are you okay just had me like bawling. And I just said,
You wanted to say, I'm okay now. Thank you.
Mm-hmm.
I was like, yeah, I'm okay. Is the family? She's like, no, 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 no. Are you okay? Is there anything we can do? I did not go through counseling and all like that, but just that moment of her showing me concern, like she was not just wanting to talk about the patient. She said, are you okay? I was so happy that somebody cared about how I was feeling. Somebody thought that maybe this is a devastating experience. Let me check. That was Tuesday. On Wednesday, HR called and said, hey, you're the new nurse. We haven't really met, blah, blah, blah. Oh my God, something happened on Saturday. So sorry. That was your first experience. We are so sorry. They knew I was a brand new nurse. And she's like, what a way to get into the door of nursing. She said, you're going to be so strong. Your staff love you and so on. Is there anything we can do? You know, we have the hotline if you need to talk to anybody. I felt like I had talked to enough people already. I was just happy, like they showed me concern. I think every facility should not just give a staff a number and say, call that number if you need to talk to somebody. I think they should show that staff concern because it went from that moment where I was judging myself, am I a good nurse? Should I change professions or something? To feeling like, yeah, some people actually care about me. I will go back the following weekend. Because at that time, I was already telling my husband, like, I'm even pregnant. Maybe I should just wait till the baby comes. Maybe I don't even know if I want to work there anymore. They knew that this person was dying. Why did they not fix the paperwork and so on? But because they showed me concern, it gave me an inner power and a love that fueled me enough to go back on the weekend, on the following weekend. So let us invest in our staff. It may be as small, it doesn't have to be pizza. Let us just spend time with a genuine question. Are you okay? Mr. Darriel, how would you, through not just through activity, you're always on the floor with the staff. How what would you suggest that can balance staff work and their mental health?
You have to prepare yourself daily, mentally. I get up early every morning, to balance myself to get to work because you never know what you're going to walk into, and you have to be ready, at any moment. If something, when you get there, it could be a straight emergency, and you have to be prepared. Can't you can't go stressful. You have always got to go in the facility, stress free and ready to go and open minded. Nothing. That's the only way you can balance. You can't carry anything with you, because a lot of people have problems at home, you
Mm-hmm.
know, but to go to work is their outlet. Sometimes they get to work. Well, am I going to be stressed, at work, so they have to, get up and pray to God,
Yeah,
and tell him to take care of your day. You know.
yeah.
Mhm.
Absolutely. Mindfulness.
Yeah.
Mindfulness. And sometimes I want to also say that if the stress level is just too much, maybe at that time it's not for you. As much as you can care for your resident, as much as you can love them, let it not be at the expense. Let it not cost you yourself.
Mhm.
Yeah, don't get lost in the process. Know that you come first. And if there's nothing in you, is if every emotion is depleted in you, is if every care or concern or compassion that you have for the patient is depleted, maybe it's time to take time for yourself and fill it back up. You cannot give what you don't have, and you can only give but so much.
Mm-hmm.
May realize, is this really for me? Be genuine about that. And to round up, Kenny,
Mhm.
as the head of the building, seeing staff go through in and out every day, all day, and facility needs to run. And we have already agreed that facility will not run without the clinical staff. How would you push to maintain their mental health?
I think the same reasons we've all talked about. You have to create an environment that people want to work in. And honestly, in order to be good in this industry, you just have to care about other people.
Mhm.
I mean, it's that's what it is. I mean, all the education, training
Mm-hmm.
side, you have to care about people, and that includes our staff.
Yeah,
That more importantly includes our staff because those are the ones that usually get the leftovers of everything else. So we just have to make sure that we take care of them in every way possible. And just those two examples you guys just shared of somebody picking up the phone and saying, "Are you okay?"
yeah,
It was huge. That's the reason why you probably stayed in your professions
yeah,
because of those experiences. As somebody reached out to you and said, "We care about your well-being. That's what we need to do."
yeah. And that is not only it, that also taught me how to care for my staff when I was in all these positions as well. That taught me how to even call my staff at home and say, hey, I heard you didn't come into work today because your mother is in the hospital. How is she doing? How to go to HR and say, hey, is there a budget? Is there something we can send her flowers? How to say, oh, my staff had a baby. We may not buy diapers, but what can we do? Can we send a card? Can we do this in their absence? When we are calling, let us not just be quick to call and say, you called in today. Are you going to show up tomorrow because we need to start looking for staff? Can we genuinely say, oh, I heard you were not feeling well. Are you feeling better today? What is
Mhm.
the plan? Yeah. Is there something we can do to help? Let us show genuine concerns. They are human beings the same way like us, and the same way like those residents that we care for. And if we can hold our residents accountable sometimes by telling them that, hey, or not feeding into manipulative situations as well, let's do that because we are their family. We love them.
Mhm.
It's not just the money. One administrator, Kenny, once said, human beings taking care of another human being is a recipe for failure because we all have this attitude. So the only way we cannot make it a recipe for failure is by being genuine with each other, being respectful towards each other, and hold ourselves at all levels accountable. And yes, taking care of our staff so that their mental health does not just get a devastating level. Mental health is a journey. We always say that it's not something that we'll talk about staffing or healthcare issues today and stop today. We are coming out with a program on how we are going to talk about, especially staff retention and the staffing issues that are faced with skilled nursing facilities. Me and Kenny and Kaamilya will be working a lot on that, and we'll be having one of these sessions every month if we can. If we need to lobby, if we need to, especially Kaamilya, you're going into your AIT position.
Mhm.
Girl, are you ready?
I'm ready. I was born and I'm here.
Good luck
I've
on
been
your
here
test.
for I'm
Good luck.
what'd you say, Kenny?
Good luck on your test.
Thank Thank you. Thank you.
You
Thank
got
you.
this.
I'm
You're gonna do
grateful.
great.
Thank
You
you.
got this. You got this. Trust me, you
Yes,
got
I do.
this. Yes. We are going to look for ways because we haven't even talked today about compliance, about ethics, about legal. Those are the things that we should dive into because they know.
Absolutely.
Last time we talked about this, Kenny, when a surveyor come in the building, before they give us a tag of on what we did not do, let's have them on the floor, not in the office. Let's have them on the floor
Mm-hmm.
and see how possible it is to do what they are asking. Maybe we can change some constitutions. Maybe we can change something. Maybe some changes or innovations will happen in healthcare that will not just benefit the patients, but the staff as well. We need to retain staff.
Yes.
We know that healthcare is here to stay, it's not going anywhere. But we'll be asking serious questions if we don't have the staff to maintain the healthcare. So it is that time that we know that everybody's mental health in healthcare facilities are a concern we talk about. Again, this is a journey. We'll talk about this next month. We'll come back with another challenges healthcare facilities face and new ways of how we can tackle those challenges. All of you who have been watching, thank you. Those who will watch later, thank you. If you have any questions or concerns, always email us at mercy at allmercypic.com or call 682-376-6776. We'll always give you new insights on what is going on. And thank you for watching our podcast. Mental health is a journey. Let's take the wheels and ride well together. Thank you all for being here today. And thank you for all your inputs. Hope you come back. Thank you, thank you, thank you so much. Bye bye for now.
Thank you, Mercy.
Bye bye.
Nice to meet all of you.